Have you ever wondered what an IHP is, or whether your child should have one? Watch this short clip on everything that you need to know about an IHP. So what is an IHP? IHP stands for Individualized Health Plan. It's developed for students with chronic and complex healthcare needs or healthcare needs that impact the school day. It is generally part of a student's IEP or 504. The IHP is developed with input and approval from the student's primary care physician and/or other healthcare providers relevant to the student. It is then written and implemented by the school nurse. It is specifically for the school district so they know what they need to supply your child with healthcare-wise. It is also developed to maintain health, participation, and academic success for your student in school. Your school is obligated to provide the health services to your student with no cost to you. However, the school can ask you to pay for part of it or all of it with health services through a financial assistance program such as Medicaid or private insurance, but only if this will not reduce your benefits or create additional costs to you. So how does one create an IHP? To do this, there's a general 4-step process. Your primary physician will be your best tool to start this process. First, the nurse must assess your student's health to obtain information that will create the IHP. This is done through interviews with the parents, health professionals, any teachers in school, or direct observation of the student. Communicating with other healthcare providers will also be key to help your family figure out what's best for your student. Next, using this information, the nurse will define the student's health needs and create a plan of care, stating step-by-step processes on how to aid the student. Along with this plan of care, the nurse will aid your family in creating outcomes and goals of the IHP. These goals and outcomes will be statement of what the student is expected to do, experience, or learn from implementing the IHP. These student-centered goals will be measurable, realistic, time-oriented, and focused on having your student be successful in an academic setting. With these outcomes and goals in mind, the nurse will implement the plan of care. Over time, the nurse and student will gather data and tweak the IHP to better suit the student's needs. This is an example of an IHP template. More of these can be found located on the PACER website. So where can you find your IHP? Finding your IHP is a critical step, especially for your student in emergency situations. So when you set it up, you need to take steps to understand where it's going to be located. The best way to do this is on your PLAAFP page in your student's IEP. Mark the corresponding box under Health Needs. Then, reference the location of the IHP in the PLAAFP section titled Other Information Essential for the Development of this IEP. An example of this would be John's IHP is located in the nurse's office. Within an IHP can be a document called an EHP, or the Emergency Health Plan. It's also known as an ECP, or an Emergency Care Plan. This is important for your child during school emergencies like fire drills or tornadoes, and health emergencies. This form can be included within the intervention portion of the IHP, or it can be a completely separate document but referenced in the IHP. That's all I have for you today. I hoped this helped. If you have any other questions on creating your student's IHP, visit the PACER website today.